Just published October 22nd, 2025, the American Thoracic Society's newest guideline on care of infants and children with tracheostomies. This guideline outlines management recommendations for these medically complex and resource-intensive children with tracheostomies, incorporating best evidence on diagnostic tools and streamlined care protocols. There are 6 recommendations, so let's get started. The guideline recommends applying ethical principles to guide shared decision making about tracheostomy placement. The guidelines suggest implementing a standardized discharge process to facilitate the safe transition of tracheostomy dependent children from hospital to home. The guideline recommends that an awake and alert trained caregiver always be present with children at risk of immediate decompensation due to tracheostomy related complications. In well children with tracheostomy tubes, the guideline suggests against routine surveillance of tracheal aspirates for bacterial growth. In children with tracheostomy tubes and concerns for lower respiratory tract infection, the guideline suggests culturing tracheal aspirate when needed to guide management. In children with tracheostomy tubes who were recently treated with antibiotics and are clinically improving, the guideline suggests against test of cure tracheal aspirates. For children with tracheostomies, the guideline suggests performing an endoscopic airway evaluation in those with a change in symptoms or with persistent symptoms unresponsive to medical management. For children with tracheostomies, the guideline recommends performing a complete airway evaluation prior to a decannulation attempt. Airway evaluation should include an assessment of nose and nasopharynx, oropharynx and oral cavity, supraglottis and larynx, and subglottis trachea and bronchi. The guideline suggests that in addition to a formal airway evaluation, either a polysomnogram or pulse oximetry study under direct observation with a capped tracheostomy be performed as part of the evaluation for decannulation readiness. The guideline suggests polysomnography with a capped tracheostomy in the following situations: assessing transition readiness from invasive to non-invasive ventilation, unclear cause of failed capping trials for patients with medical and or airway complexity. And there you have it. Make sure to check out the full guideline from the American Thoracic Society and other related clinical decision support tools at guidelinecentral.com.